This recording will cover malignant lymphoma. We're going to talk about the two different types, signs and symptoms, and nursing priorities. Lymphoma is a cancer of the lymphatic system, which is part of the immune system, that causes white blood cells known as lymphocytes to grow uncontrollably and accumulate in lymph nodes, the spleen, or bone marrow. Remember, lymphocytes are a type of white blood cells that are important for the immune system and responsible for defending the body against bacteria, viruses, and cancer. They originate in the bone marrow, circulate in the blood and lymph tissue, and function primarily as B cells producing antibodies or T cells killing infected cells. While lymphocytes continue to exist and multiply in lymphoma, they don't function properly. Instead of defending the body as part of the immune system, they're mutated, and they grow out of control, accumulate in lymph nodes, blood, and bone marrow, and these disease cells crowd out healthy tissue, and they can't fight infection. So malignant lymphoma is a cancer of lymphoid tissue, which includes lymph nodes, spleen, and the broader lymphatic system. And the two main types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma, are differentiated by whether or not they have Reed-Sternberg cells present. If Reed-Sternberg cells are present, the diagnosis is Hodgkin lymphoma. If Reed-Sternberg cells are absent, the diagnosis is non-Hodgkin's lymphoma. There are other differences between Hodgkin and non-Hodgkin lymphoma besides whether or not Reed-Sternberg cells are present. So if there's Reed-Sternberg cells, that would be Hodgkin's lymphoma. Another difference is that the pattern of spread is orderly with Hodgkin's, where it's very random and unpredictable with non-Hodgkin's. Hodgkin lymphoma usually starts with a single lymph node group being affected, where non-Hodgkin has multiple peripheral nodes affected initially. So just in general, Hodgkin's is going to be more orderly, more predictable, where non-Hodgkin's is less orderly and less predictable. So for Hodgkin's lymphoma, this type of lymphoma usually starts in one lymph node group and spreads in an orderly fashion. Patients with Hodgkin's lymphoma also have Reed-Sternberg cells. So this is a defining pathological feature of Hodgkin's lymphoma. And basically the pathological feature are these abnormally large lymphocytes known as Reed-Sternberg cells. Non-Hodgkin's lymphoma spreads randomly, doesn't spread in a predictable pattern, and also this type of lymphoma does not have Reed-Sternberg cells. The biggest early sign of lymphoma is a painless lymph node enlargement. So that's the most common early sign we're going to see, typically in the neck, axilla, or groin area. And remember, if it's painless, we want to be worried about lymphoma. Usually with infection, they'll be tender. Other things we'll look for are systemic symptoms, also known as B symptoms. They include fever, night sweats, and weight loss. Finally, some other symptoms that we could watch for include fatigue, pruritus, hepatosplenomegaly, and anemia symptoms later in the disease. The most important test for diagnosis of lymphoma is going to be a biopsy of a lymph node. That's going to be our definitive diagnosis. No biopsy, we won't have a diagnosis. Imaging can help with staging, but again, the biopsy is the key to getting a diagnosis. Other things we can look for in labs include decreased red blood cell, white blood cells, and platelets, which can be seen in later stages due to the bone marrow involvement, and increased ESR, erythrocyte sedimentation rate, which is a marker of inflammation. Now, you don't need to memorize the staging, every detail of this, but you want to understand how this can progress. So initially, just one node region could be involved, then multiple nodes on the same side of the diaphragm, then nodes on both sides of the diaphragm, until there's diffuse organ involvement, including the liver, bone marrow, and spleen. Treatment depends on the type of lymphoma and the stage. Primary treatment for both Hodgkin's and non-Hodgkin's lymphoma is going to be chemotherapy. The patient may also receive radiation, immunotherapy, which is a targeted therapy, or possibly even stem cell transplant for severe cases. Your priority nursing consideration of caring for a patient with lymphoma is going to be infection prevention. Remember to monitor for a fever, which can be an emergency in a neutropenic patient. And remember, it might not be a super high fever, so 100.4 higher, or an increase from baseline of 1 degree of Fahrenheit. For patients who are immunosuppressed, this is something that we need to let the physicians know about. We also want to make sure we have bleeding precautions on board. Because of low platelets, the patient's at increased risk for bleeding. We want to make sure we have fatigue management or energy conservation strategies on board. Because of the low red blood cells, the patient will be anemic. Also, we want to consider nutritional support for the patient. We can get a registered dietitian on board, and they may need supplemental nutrition. So just a reminder, with chemotherapy, we want to be providing antiemetics for nausea and vomiting, helping the patient with dealing with alopecia or hair loss. And a big important one is monitoring bone marrow suppression. We're going to be monitoring those CBCs closely. Remember that low white blood cells puts the patient at risk for infection, low platelets at risk for bleeding, and low red blood cells at risk for anemia. Some key points. Remember, if your patient has a painless lymph node enlargement, we're worried about lymphoma until proven otherwise. If they do a biopsy and Reed-Sternberg cells are present, that would be indicative of Hodgkin lymphoma. If not, non-Hodgkin lymphoma. Remember to assess your patient for systemic symptoms, also known as B symptoms, which include fever, night sweats, and weight loss. Remember, Hodgkin spreads in an orderly fashion, while non-Hodgkin's is random and unpredictable. And then lastly, remember that biopsy is going to be the definitive diagnosis. So lymph node biopsy will be what's done to give us a diagnosis of lymphoma. This slide has additional need to know information that we've already talked about. A reminder, the staging is just an FYI. You want to understand how the disease progresses, but not necessarily each stage 1 through 4. For patient teaching, remind your patient that they need to report any fever immediately. Because they are immunosuppressed, a fever would be considered an emergency that we need to provide interventions for. Teach your patient to avoid infection exposure, such as crowds or sick friends and family. Stay up to date on vaccinations and adhere to follow-up scans. Remind the patient to report any systemic symptoms, such as night sweats or weight loss. This could indicate disease progression. So some clinical considerations. Early detection is important. So monitor for lymph node changes, especially a painless enlargement. That's a key first sign that we'll see. For treatment of complications, we're monitoring for infection, bleeding, fatigue, and chemo side effects throughout the course of treatment. And then we need to be sure we're providing psychosocial support for the patient. This slide's a nice comparison slide that lets you look at the difference between Hodgkin lymphoma and non-Hodgkin lymphoma. In a review of key takeaways, if Reed-Sternberg cells are present, we're looking at Hodgkin lymphoma, painless lymph node enlargement, and systemic, also known as B symptoms. We want to act fast. So those are clinical red flags that we're dealing with lymphoma. We need to explore diagnoses. Biopsy is going to be our definitive diagnoses. And in terms of nursing priorities, infection is going to be our number 1 emergency. Fever in an immunosuppressant lymphoma patient requires immediate intervention. We'll also be looking out for risk for bleeding because of low platelets and anemia because of low red blood cells.